I had always wanted WUSF to be able to engage in deeper journalism activities. Didn't exactly know how we were going to do it. Our budget is limited like everybody else's. And then this grant comes out. I think we had a good mix of stations, and that includes all of our stations in Tampa. WMNF, standalone radio station, WEDU, standalone public television station, and the others were all joint licensees. So it gave us more opportunity to have our material on both radio and television. When we started to look for an executive editor, somebody who would direct the project, we looked for somebody who had experience in reaching the audience that we were trying to reach, younger, more diverse. And we looked for somebody who had multimedia journalism experience.
I liked that it was a multimedia project, particularly around health. I had done health work in multimedia before.
She'd won awards, she was working at Newsweek.com, her resume was impressive, and then when she came to meet with us, she just had a very different perspective on how we could do this.
Most newsrooms today, most media agencies don't have a health editor, let alone a staff of 5 health reporters, multimedia reporters, shooting video. I mean, it's just unheard of. So people are hungry for the content.
I did a series of videos and also a print piece for the Miami Herald about a new surgery called the sleeve gastrectomy. It's been interesting learning what people struggle with and how far they're willing to go to overcome something that's kind of holding them back when they feel like they're successful in so many other areas of their life.
I think part of our success has been hiring the right team. And I think all of our reporters are terrific. They each bring very specific knowledge and talents. They've all been doing a lot of on-the-job learning.
Okay, yeah, let's the end.
It was just, 6 months ago that we were learning how to turn the camera on and how to charge the battery.
I've had my share of mistakes. My purse is in a lot of the shots. My car is in almost every outdoor shot because I would park in front of the building and then I would remember, you need B-roll of this building, Dalia, and I would just shoot it, and there's my maroon Honda Civic making a cameo in like every single video.
The Rolling River of News is our way of trying to be on top of what's going on in healthcare. We can't cover every story with our limited resources, but we can be covering what's going on by using other media outlets.
October is National Domestic Violence Month, and Verizon had offered us a grant to help put something together.
Hello and welcome. I'm Angie Moreski. If you are a victim of domestic violence, if you know a victim, perhaps a relative, a neighbor, or a coworker, there is help available. The number on your screen, 1-800-5...
The reporters built a multimedia package for our site around it.
It just went from pushing and shoving and, slinging, and I guess each time it just escalated.
The primary goal in Betters Intervention is, first of all, to help them be accountable, to help them identify that it's not just the physical violence.
People can learn a couple things by looking at thehealthystate.org. WUSF did it right by making this program headed under one person, because then we really are a team.
I think that what she's done has really tried to transcend station culture and really help us understand multimedia journalism culture. That is the future. How do we achieve being the touchstone for a whole younger and more diverse generation than we've ever reached out to before? And so I think Jen is helping do that. It's uncomfortable at times because our partner stations are saying, where's the radio? And there is some radio, but there's also all of the other things that we think are attracting this younger audience that is the essence of the grant.